Can healthcare in the third world be transformed by the principles of, get this, fast food franchising? Out on the highlands of Kenya, we first met Michael Side.
How are you?
One of the world's top experts on franchising. He was a businessman on a mission.
I've never had the chance ever to say, I might be able to save somebody's life. I may be able to save more than one life. And that's a heady kind of statement for a guy who just does franchising.
Side is one of several big names in franchising who are convinced that the business model making millions of dollars in the U.S. can save millions of lives in Africa. Over $500 billion in foreign aid has been given to sub-Saharan Africa over the last 40 years by one count, yet terrible health conditions remain endemic.
The money's already flowing into Africa, so it isn't really a question, is money available? The real question is, are there better ways to use the money that's already flowing in?
Medicines in Africa tend to be pretty cheap, especially the drugs that treat the most common causes of death, like malaria and diarrhea. Plus, most African governments try to offer those drugs for free. The big problem is how those drugs are being delivered. Bad roads and weak regulation prevent good quality medicine from getting to people in the first place. For instance, many drugs that are sold on Kenya's streets are counterfeit.
They just wrap it up in a little piece of paper, and it's a pill. It could be a sugar pill or chalk. And a desperate mother will do anything to get the medicine, so they take advantage of that market opportunity.
But franchising has its own internal checks and controls that encourage the sellers of medicine to do the right thing. Quality and consistency is at the heart of successful franchising operations.
We're all familiar with Subway sandwiches. If you go into a Subway anywhere in the world, you'll find that they wrap the chicken wrap exactly the same way. We need to be diagnosing and treating disease that consistently.
Here's how it works. The CFW people recruit local Kenyan entrepreneurs and carefully vet them to make sure they're qualified to deliver health care and run a small business. The first test for Credence Mena was to raise the equivalent of $300 to pay what's called a franchise fee, just like you would for starting any Dunkin' Donuts in the U.S. In return, the central office gave her business training and a microloan to get the shops outfitted with medicine. These resources allowed her to be her own boss and support a decent standard of living. Plus, the franchise is well suited for replication and expansion on a large scale because the overhead to run the entire network of shops gets so much cheaper when measured per store. Mena is still a champion among the top sellers of all CFWshops franchisees, who have now served over 2 million patients. And if CFW is successful in the long run, they hope to inspire others to take their franchise model and run with it in other countries.
This is how ultimately we can make franchise healthcare just as commonplace as microcredit has become throughout the world.
Emmanuel Ndoba leads CFW in Rwanda. Ndoba, born and raised in a refugee camp, knows what it's like to have little access to health care. Half of his 10 brothers and sisters have died from disease.
But knowing I'm here sitting, thinking, doing to help another life, to save another life, that is for me huge enough. The relationship between the community and the CFW clinic is what is going to make this model actually work in Rwanda and other countries.